Keep an eye on it here. Huh? Oh, I've already started.
All righty. Good evening, everyone. And I think I know most of you, so happy to see everyone here. And I would like always to congratulate you for making the decision to go for bariatric surgery. Today, we will be discussing issues that we don't usually discuss with our patients when we see them in the hospital or the outpatient settings, because we don't have time for that. We will be talking about the science behind weight gain and weight loss. And the goal is actually for everyone to undergo successful weight loss after bariatric surgery. So we will be talking about the appetite regulation system, because to me, obesity or weight gain is actually it happens when we have a disease. And when the disease that we have that caused us to gain weight is that the regulated appetite system in our body becomes dysregulated. And the whole idea of doing medical treatment for weight gain or surgical treatment is to try to regulate our appetite system again so we can maintain our weight down, okay? So I don't want this to be a lecture. If anybody has any question at any time, please feel free to ask. But our goals, we want to talk about the science behind weight gain or loss. We want to understand what's energy balance and what's appetite regulation system. And we want to hopefully reach the understanding that, what we as a physician tell our patients, eat less and move more, is a myth. It's wrong. It's not going to help,
It should be myth, not myth.
It's myth. What did I say?
I said it should be myth, not meth.
Myth. Okay. Oh, yes.
That's my fault.
Was late last evening. Okay. Then I'll talk about the natural history of weight loss, and then hopefully talk about how to prevent, or what we need to do to prevent delayed weight regain. And then we will discuss, medical versus surgical quick, and I'm not going to spend a lot of time, and introduce a new paradigm for obesity treatment, hopefully by the end of this discussion. So I just want you to look at this slide. And this is, it tells about the trends for obesity in our country between 1994 and 2013 in the upper, maps. And the lower maps talks about diabetes. Clearly, you can see that we, as a medical professionals, failed to control diabetes and obesity in this country. We as a healthcare provider. We think that we have the technology and the advances, but unfortunately, you can tell, as the slide goes red, it means that the percentage of people who are having weight problem goes up. And clearly you can see that over the past 22 years, or 20 years, that we got up to more than 35% of the population, they fall under the category of body mass index above 30. And more than 2/3 of the population falls under the category of overweight. So if you look at it, you feel like we're dealing with maybe Zika virus. It looks like it's contagious, but everybody seems that maybe in 2023, everybody's going to have the problem. So if you don't have it in your household, it's going to come to you down the road. And as you see also, this is for diabetes. People who have weight problem, they end up having diabetes problem down the road. So this is energy balance. And those people who I see in the clinic, we all